First of all, I'd like to welcome the nurses in the gallery into this debate tonight. I suppose I'm glad to see that the Minister for Finance has joined us. For long periods of this debate, we've had no member of Fine Gael in the chamber, and the person in charge of the money. It is good that he's here to hear what's been said in the House. And nurses provide an essential service to our communities, and I'm not going to repeat what has been said by others, but we've all had experiences in hospitals, and nurses, you cannot overvalue the service they give to the communities. But while this dispute is about pay, I think has been said by a number of speakers already, working conditions and the conditions that nurses at the moment have to work in, and the stress that is bringing to their lives, are a huge part of the grievances at the moment. And the two major hospitals that service my constituency, Clonmel and University Hospital Limerick, unfortunately are two glaring examples of that. And I was in Limerick University Hospital last weekend, and to work in the crowded and cramped conditions that they're being asked to work in there is unreal. And you would be exhausted yourself when you'd come out from visiting a patient, and to try and work there for a long shift and to deal with the amount of patients they have to deal with is putting extreme pressure on this valued profession. The pay claim that the nurses have brought before us, it's no good saying that this is going to bring other pay claims across the public sector. The nurses have balloted for strike action. We have to face up to that situation, and we have to meet it head on. I think their case is crystal clear. They are underpaid at the moment. We're failing to recruit nurses into the service. We're finding it very hard to maintain staff, and we have to address the issues that have been raised by the nurses.